US is still suffering from the coronavirus pandemic, and it's actually suffering far worse than it has in months. We're seeing hospitalizations at the highest level ever. We're seeing deaths reaching records. Talking about the whole pandemic here, not just since April, since the first peak. The whole pandemic, deaths have never been this high. We're talking about daily cases approaching 200,000 per day on average. For context, Australia has recorded fewer than 30,000. In the entire pandemic, the US is recording hundreds of thousands per day at this point. On top of that, the vaccine, which is wonderful news, and Donald Trump deserves some credit for his administration's efforts to get the vaccine out as quickly as possible. He does. Operation Warp Speed, they call it. It's a bit of a lame name, but it's worked fairly well. But the vaccine, as fast as it has come, it's not going to be widely available to Americans until early to mid next year, 4 or 5 months away. And in that intervening period, the virus is still spreading and people are still dying and emergency rooms are still filling up. We've just had Thanksgiving with a lot of people defying advice and moving across the country to visit their families, having Thanksgiving dinner together in an enclosed space without wearing masks, potentially infecting people of different ages, some of them in the vulnerable age group. We have deaths starting to spike, as cases did a few weeks ago, because deaths always lag behind cases. And on top of that, we're going into winter. And American winter is not like Australian winter. American winter is really bloody cold. People congregate inside for months on end. And when you're inside, the virus transmits more easily. So we're entering such a dangerous period. And this ties into the politics of the election, because at the moment we have a president in this country who is not focused on the pandemic. He speaks about the vaccine, which is, as we've said, good news. Bring it on as quickly as possible. But the intervening period matters as well. And there are warnings that tens and tens of thousands of Americans could die before the vaccine is widely available. And the current administration is doing nothing whatsoever to prepare for that or to try and prevent that. When we talk about the rollout of the vaccine, we have to understand that it doesn't all happen at once. It doesn't happen within a week-long period. We're talking about a country with more than 300 million people, all of whom need to receive this vaccine. That's more people than have been tested for the coronavirus throughout the entire pandemic. It's a huge operation. You have to reach people who are in different socioeconomic classes. You have to reach people who are in different parts of the country, different age groups. It's a huge operation, and it takes time. So while the administration does say we are going to see perhaps 10 to 20 million doses administered before the end of the year, which is wonderful news, those are going to frontline medical workers. They're going to the most vulnerable populations, as they should. But that leaves hundreds of millions of Americans who will not have the vaccine for months. It's going to take time to roll that out, to distribute it to doctors, to get doctors to administer it to all their patients. And in that intervening period, that's the danger time. That's the time when there is still not anything resembling mass immunity to this virus, and people can still catch it and people can still die from it.